This year's campaign in the state will be integrated with the Seasonal Malaria Chemo Prevention, or SMC. And that is because SMC has proven to be a life-saving intervention where we distribute a combination anti-malarial, sulfadoxine-pyrimethamine and amodiaquine, which is a malaria prevention drug, to children aged 3 to 59 months. Presently, about 2 million children under 5 will be reached in this year's campaign in the state from the months of June to September 2025.
The Permanent Secretary of the Kaduna State Ministry of Health, Dr. Aisha Abubakar Sadik, explained that the essence of the briefing is to profile possible solutions and solicit the support of media organizations, development partners, community, traditional and religious leaders to sensitize people in its fight against malaria across the state.
This year's campaign, however, will witness a slight modification because according to the targeted distribution strategy of the National Malaria Program, who serve as our lead, and in order to preserve our environment, we have to retrieve old nets we have previously distributed to our population through the end-of-life nets program, which means we will give you new nets and we'll have to collect the old ones which are no more useful to you as a preventive measure.
Dr. Aisha Abubakar added that the insecticide-treated mosquito net is targeted to be distributed to over 1.8 million households across the state, which will commence from 30th June to 3rd of July 2025.
It is based on the incidence of cases of malaria recorded in the state, so we prioritize those with higher cases of malaria as opposed to those with lower reported cases. We also utilize some demographic, epidemiological, and physical considerations to ensure that communities and wards with the highest prevalence and incidence receive the nets first.
She urged all the 23 local government councils to support the program actively and give maximum cooperation to eradicate malaria across the state. Speaking during the news briefing, some of the development partners expressed their readiness towards supporting the state government in its fight against malaria and called on people of the state to participate actively by ensuring proper hygiene and sanitation in their locality. The insecticide-treated mosquito net will be distributed to the most affected communities across the state. Enoch Olajide reporting.